you into the office?
So I've had low back pain for about 2 years now.
Okay.
It all started at my old job.
Okay.
I used to be a custodian, carried a 20-pound backpack, cleaned classrooms, and at the end of that shift, my back was burning.
How long were you doing that for?
Custodial was 4 years.
4 years of custodial work, 20 pounds, you were carrying, cleaning, bending, twisting, all of that.
Mm-hmm.
And so what happened? End of the day, your back is burning, you're saying?
Yeah, like the low back was burning. I had to literally sit down different ways just to get comfortable.
Okay. How long ago was this?
This was 2 years ago.
2 years ago, okay.
Yeah, and from there, I went to, I had a workers' comp.
Okay.
Had x-rays or MRIs done.
Okay.
At the end of the day, they told me it was bulging discs.
Okay, so you went through workman's comp.
Mm-hmm.
They sent you to the doctor.
Mm-hmm.
You got MRIs and x-rays.
Mm-hmm.
You've brought them today, and we're seeing that, and on the report it says multiple herniated discs,
Mm-hmm.
right? Starting at L1, or sorry, L5, L4, L3, L2.
Mm-hmm.
Okay. And what did they recommend? What were you recommended then?
I was recommended to go to physical therapy.
Okay. And did you?
I did.
Okay.
Just a month, because then after they just canceled my workers' comp.
Okay, so you went for physical therapy. Did they do anything else? Did they recommend surgery, cortisone shots, anything like that?
Yeah, they did the cortisone shot, and from there, that was it.
Okay, so you did cortisone, which level do you remember?
I'm not sure. I think it was really minimal.
Okay. In the low back?
In the low back.
Okay, so you had physical therapy and one cortisone shot?
Two.
2 cortisone shots in the low back?
Yeah.
Okay. And you're saying you got canceled after a month?
Yeah.
Okay. Are you still doing that same job?
No.
Okay. And tell me what's happened since with the back and the pain.
I've been stretching. I've gone to other chiropractors, but.
So it's the same as it was 2 years ago, or it's getting progressively worse or slightly better?
Slightly better.
Yeah, you're managing it.
I'm managing it.
Okay, so you're managing it with stretching and.
That's it for now, and like working out the back, strengthening it.
Okay. And that's you're saying, so let's say when this started, you went through this process, let's say it was at a 10. Where are you at today?
It's like at a 6.
Okay.
6.5.
And it is affecting your quality of life?
It is.
Okay, that's why you're here.
Yes.
Okay. What do you do when it's at its worst?
I have to ice and I have to stretch.
Ice, and does that get you through?
Through the day at least.
Through the day. At the end of the day, things are then tight and stiff? Or?
Yeah, on the low back.
Okay. And that's the main reason you're here?
For the most part, the low back.
Is there any other issues going on we need to know about?
My left leg, sometimes I feel like it swells up, but it doesn't look swollen.
Left leg or left thigh?
Left thigh.
Okay, so when you're feeling that this swells up?
Yeah.
Okay. Do you recall, is it event or activity dependent or time dependent?
I think it might be time.
End of the day?
Or
Or in the beginning of the day?
It's usually in the middle of the day.
Middle of the day. And right now, are you still doing physical labor?
Not necessarily. I sit in front of a desk now.
Okay, so now there's posture issues
Posture.
you need to deal with. Okay, so you went from having 20 pounds on your body that actually contributed to your back pain, and now you're sitting at a desk, which isn't making it any better.
No.
Okay. All right. What else?
Well, my left ankle started hurting recently last week.
Okay.
For a second I thought it was the shoes, but then it comes and goes, so.
Okay. What else?
That's it.
All right, so let's start there.
Okay.
So we have enough to focus on in terms of the low back and following kinetic chain down into the ankle, right?
Mm-hmm.
And as you know, being here, we're checking everything anyway, right? Now what I'd like you to do is go ahead and touch your toes. Are you able, you can bend your knees if you want to, it's okay. But you're able to touch your toes, right?
Yeah.
So this is what I'm saying. One segment is stuck, the others have to compensate to allow you to do that. Make sense?
Yeah.
We're going to start at the base of the neck. And let's see what we find. Now, if we get something in the upper cervical, we obviously want to clear those messages, right? I should be careful what I say, shouldn't I? Because we're getting a reading up top left. The question is, did you get that from your girl, or did you give it? Who gave it to who?
I'm not sure.
I don't know. There's a significant amount of pressure on the left atlas, around 15 points, okay, sir?
Okay.
Now, as we go down the spine, interesting. It's staying on the left the whole way down. This is atlas cord pressure to start, my friend. Do you remember me talking about atlas cord pressure?
Yeah.
Right? When we have pressure up top, it'll affect everything all the way down. And we're getting a slight reading, 10-pointer, left side here, sacrum. So, parasympathetic. Tell me how your digestion is. For the most part.
So for the most part, I always go to the restroom in the mornings.
Okay. When you're eating, more importantly, do you feel like complete? Do you feel it's stuck here? Do you feel like when you eat, everything goes through okay, or do you feel kind of stuck here?
It feels kind of stuck.
Okay. And has that been for a while?
Yeah. I always thought it was because I was lactose intolerant.
Okay. What if you don't, what if it's just regular food? Like if it's not dairy or gluten, are you still feeling that here?
Mm-hmm.
Yeah, okay. The reason I ask that is you have parasympathetic nerve pressure up top and down low. The parasympathetic nervous system is responsible for resting and digesting, whereas the sympathetics are the fight or flight mechanism. Okay, let's go ahead. I still want to statically palpate down the spine. Not so bad. A little bit in the left SI joint. Okay. Head down, please. So you have a lot of tightness here, right? A lot on this left side. Now, let's go ahead and just palpate the cervical spine. Looking at his overall x-ray, there's not a lot of curve in there. And I'm just going to be rotating left, rotating right, rotate left. So there's more rotation to the right than to the left. But that's not the primary thing we're looking for when we're analyzing the atlas. We always want to check laterality first. Laterality refers to which capsule is swollen. There's no disc at C1. There are two lateral masses and there's a capsule. This is what I'm talking about here. So C2 down has a disc. C1 has these two lateral masses. There's two joints there, and there's a capsule there. And the first thing we need to know is which one is bulged. Very rare do both. Very rare do both of those bulge. Okay, so laterality refers to which way it's tilted up. Okay, so that's what I'm checking for. When we're doing this, let's check left and right. That's right. That's left. So what's interesting is the bulge is actually there. Do you feel that? So it's a little misleading. We got a reading on the left. The bulge is on the right, but the rotation restriction is to the left. Head down, please. Turn left. Turn right. Do we agree? Okay. So when we're listing, and it should match on the film, there should be an ASRA. Okay? And here's the reason why. AS is anterior superior. Atlas goes like that. We have right laterality, and when we're going down into flexion, we're isolating the upper cervical. There's less rotation to that side. Why? Atlas is gone anterior on this right side. So it's doing this. It's gone anterior this way, so when I try to rotate more that way, there's nowhere to go. Does that make sense?
Yeah.
We have an ASRA atlas. Right side is higher, left side is lower, which is consistent with the film. Feet together, open and close the knees. Now, I listed the pelvis. I marked the film. I listed the left pelvis according to the Gonstead work, going with the lowest lumbar body rotation. That's the side we list. But we have to go which side is fixated. If it's the left side that's fixated, then we go with that left pelvis listing. If the right side is fixated, it's the exact opposite, and that would be the AS. Does that make sense?
Yeah.
Okay. Feet together, open and close the knees, please. Left side only. Interesting. I should be careful what I say. The right wants to go. Right side only. So does the left. Do you feel that?
Yeah.
Which side feels more stuck to you when you do it? Left or right?
Or
The right side.
yeah.
So, we listed the left pelvis on the film, but the right is the one that's restricted. So, does that make sense relating back now to your loss of curve? We said an AS would cause that, remember?
Yeah.
Not a PI. And there it is. It's more tender up here
Mm-hmm.
than down here.
Mm-hmm.
AS ilium left on the right side. A little bit, but it's not as bad. Scoot back for me, please. Back towards me. L5, S1, S2, S3, S1. They're all kind of sore, right?
Yeah.
That one is what I feel swollen the most right there. That's S1. So, S1, right pelvis, right atlas. Let's check out his feet. Head on, please. Okay, now stop back there for a second, please. Stop there. March in place. And what I want you to notice is as he's marching, he's starting to veer to that right side. The right foot slightly wants to turn, and then he kind of supinates it out, and then he compensates it back in with pronation. Raise your gown so I can see your knees, please. Keep going. And stop. Okay. Go back a few steps, and then go ahead and walk towards me, regular walking. Let your arms go. Keep going. And there's a drag in his step. You kind of drag those feet, right? Which one do you feel more, left or right?
I think the left.
Yeah. And that's because it's lower on that side. Pelvis is lower on that side, so it's dragging.
And sometimes I feel like I'm always
You're always.
tripping.
Let's fix that. This is my thought process.
Mm-hmm.
So I said if there was an ASIN, but the rotated sacrum is on the opposite side. Here's what I like to do. We're gonna set your atlas first, up top. I'm gonna have you walk once. I wanna rescope. And I wanna motion sacrum and pelvis and see if there's any change between the two.
Okay.
The sacrum is what needs to be fixed. But I wanna make sure that, because there's also the pelvic involvement, which one is more dominant, which one is being contributed from the atlas. Let's go over here. And we said ASRA. Good. Home run. Go ahead and have a seat. Tell me if anything else feels different. What's different?
I thought I felt like a stretch here. It's all gone.
And you're already starting to get a little curve, dude. So there was a 15-point reading on that left side. It's clear now. That's still all clear. Guess what? That 10-pointer is clear. So what does that tell us? I'm doing your pelvis, right? Scoot forward, please. Back towards me. Different?
Yeah, less.
It's not all gone yet,
No,
but
it's less though.
Let's feel the pelvis. That's still there, but less. Yes?
Mm-hmm.
Okay. Let's go ahead and set that right pelvis, please. 1, 2. Now, contact from the PSIS, 2 inches lateral, 3 inches inferior. That's the contact for the ASIN right there. Now, when we look at it, it's more AS than IN. So I'm gonna just bring my fingers right about there. I'm gonna roll you. I got you the whole way. Roll you as a unit. And we're gonna set it down and out, just like that. Home run. Dígame, señor.
Feel lighter.
Walk on your toes. Turn around, walk on your heels. How does the back feel when you're doing that?
Feels good.
Okay, touch your toes. Any different feeling in the back?
It feels different. I'm not stuck.
You're not stuck. You're not touching them yet, but
Yeah.
you're not stuck.
I'm not stuck.
Okay, sit on the floor, please. However you sit. How's it feel sitting?
Different. Right side, I might feel a little like a pinch.
Okay.
But it feels better.
Feet together. Open and close the knees. By the way, the dimples are more level now. Right side only. Left side only. Much better, dude.
Yeah, I don't feel it going all together.
It's not going with it. They're moving independent. Let's go ahead and check L5 sacrum. We're gonna get to the sacrum, okay?
Mm-hmm.
Probably hopefully by the next visit. That's already different though. See?
Mm-hmm.
You know, a lot of people see these adjustments and the cracks and this, but the people that are coming here, they're coming for an answer. They're not coming for the adjustment. The adjustment is the easy part of this.
Mm-hmm.
It's finding the problem area.
What do we have?
What do we have exactly? You're all clear there, brother. Scoot back for me, please. Let's go on your back. I want to check your ankles, okay? I'm going to use the board just to get it started, because remember, we adjusted your right pelvis. I don't want to disrupt anything on that side.
Okay.
So I don't want to be pulling on your leg today, okay? I'm going to go ahead and just set this to get it going. A lot of this is going to get resolved from that pelvis, though. There you go. Stand up and walk it off, please. All right.
Feels like I can breathe better.
After a foot adjustment?
Yeah. Well,
I'm joking. Keep walking.
it's the whole adjustment.
So you're breathing better right now.
Yeah.
You're not pronating as much, by the way. Your arches have already changed. Not bad in one adjustment. Okay. Squeeze. Squeeze. I do have to work on your elbow and your wrist on this side, okay? There's one. Posterior distal radius. There you go. Posterior lateral scaphoid. Squeeze. Squeeze. And I do like to do the ears. Get that fluid going in the semicircular canal. And that's where we're going to start.
Thank you.
Squeeze. Questions?
No.
Okay. Water, walking, and ice. I'll see you Wednesday and Friday this week. Okay?
Sounds good.
Welcome to the office.